Hi, and welcome to 21st Century Home Health Consultants podcast. We are Home Care Today. I'm Kate Rose. I'm your host, and I have a very special guest with me today. This is Patti Heid. And Patti, you are the Senior Director of Best Practices and Compliance at Home Care Association of Florida. Now, that's a mouthful.
Yes,
and so I'm looking forward to having you tell me a little bit about where that is, what you do, how you do it, and that's what we're going to be chatting about today. So if you would, give me an overview of what you do there.
Sure. So the Home Care Association of Florida, or better known as HCAF, is a trade association for home care providers in the state of Florida. We represent those individuals that own businesses that are Medicare, Medicaid certified, private duty, homemaker companion, and nurse registries. And so our job, our mission is education, advocacy, and resources. And so our goal is to be the resource in the state for anyone running a home care business. And my job as Senior Director of Best Practices and Compliance, I basically am in charge of making sure providers run their organizations in a compliant and quality manner.
Now, when you talk about compliance, who are we compliant with? What is the oversight agency or operations system that says this is what you need to do and this is how you need to do it? Where are these regulations coming from?
Great question, because there are a lot of regulations in home care.
I bet.
Yes, ma'am. And so, first of all, there's the state, HCAF, which is the licensing authority for the state of Florida. So there's state regulations. And then if you are an organization that provides skilled private duty services, you have to be accredited. So you not only have state regulations, but you have accrediting body regulations. And then if you're Medicare and Medicaid certified, you not only have state and accrediting body regulations, but you have the federal conditions of participation that you have to follow as well. And then your agency policies are mixed in there somewhere too. So when in doubt, you have to follow the most stringent out of all of those sources, and it can be very confusing for providers.
This is not my line of work, and I feel very intimidated just hearing about all of this. So I can only imagine how valuable it is for folks in the field to have access to somebody such as yourself with this organization to give them the reassurance that even though it's a lot to know and understand, there's a lot to make sure that you cross the T's and dot the I's appropriately. They don't have to know every single thing about it themselves because you're there.
Absolutely. And it is a constantly changing environment. Regulations can change year to year. And so even myself, I don't have all the answers. And I'm smart enough to know that if I don't have the answer, I have the resources, the industry connections, the industry experts in certain areas where we can reach out to. And if I don't know the answer, or we as an organization don't know the answer, we can reach out to those resources and get the correct answer for someone.
So if I'm hearing you correctly, HCAF collaborates with other organizations and associations in order to be able to ensure, to the best of your ability, that your clients are compliant. Is that correct?
Correct.
So what would it look like, for example, for you to collaborate with another organization on a compliance issue?
Okay, so usually if somebody calls or emails and has a particular question, let's just say it's a billing issue that they're dealing with a managed care plan or organization, and they're having difficulties. We have the connections usually within those plans that we can reach out and say, hey, could somebody take a closer look at this for us? They want to make sure they're billing in a compliant fashion. They're not getting paid. We just need to have other eyes on this. And because we've established those relationships, people are very happy to take a quick look at it and let us know, are we going in the right direction with this? What needs to change, or what they can do differently in order to, come into compliance.
What are the steps that I would take if I had a concern in the field and I came to you and I'm, for whatever reason, maybe some of my reimbursements for Medicare are not going through smoothly all of a sudden? How would I reach out to you? How would I let you do your job? And what would be as a rule, an average amount of time before I might get an answer back or have a plan that you would show me, this is what you need to do in order to correct the problem, here's the problem, and here's what you need to do, and this is about how long it would take me?
So it's as easy as picking up the phone or shooting us an email, or most people have our cell phone number, so you can call or text us anytime. And it depends on the situation. Some answers we have right off the top of our heads. Some, if we have to go through other channels, we're sometimes at the mercy of their schedules and the size of their inboxes. So a lot of times, if something, we'll at least acknowledge individuals and say, we've got this, we're looking into it, just give us a little bit of time. If you don't hear back from us in a couple of days, circle back around and we'll nudge a little bit and we'll see if we can get an answer for you. So it really just depends on the situation at hand.
So your association, is that something that I would become a member of?
Absolutely. We are a membership organization.
Okay.
We have different types of memberships depending on the needs. If you're private duty and held only to the state standards and you're not Medicare, Medicaid certified, a private duty membership would be appropriate for you. But if you're somebody that now has to follow state accrediting body, federal regulations, your need for resources is going to be a little bit greater, so a certified membership would be appropriate. Plus, we also have an associate membership, and those are organizations or individuals that provide products and services that support homemakers or home care agencies. And those individuals or organizations are welcome to become members of HCAF. And those are individuals that we will collaborate with quite often in order to help providers run their businesses successfully.
As a member of HCAF, what would be the top 3 or 4 benefits to me if I were looking at your organization and considering becoming a member?
So I can speak to this not only from the HCAF side, but as a staff member, but I've been on the provider side.
How is that? Tell me a little bit about that.
So I started out, I'm a physical therapist, and I started out as a field clinician and then rehab director and eventually made my way up the management chain, so to speak. Mm-hmm. And then at some point I landed in my position with the Home Care Association. So I've been in home care probably about 23, 24 years now, probably more years than I care to count. However,
but that represents a lot of solid experience.
Absolutely, at all levels, not only just in management, but I've been out in the field working with patients one-on-one in their homes. So I kind of understand all aspects of an agency's operations. And so with that being said, I've been on the provider side of the fence, and so I've used HCAF resources as a provider. Mm-hmm. Biggest benefit, being able to pick up a phone, send an email, and get an answer, because so many times providers will hear from various staff members, well, that's not how we did it at our organization, or so-and-so said we should be doing it this way, but they don't have the regulations to back it. So when I was in a management position, I could reach out and I could get it straight from the horse's mouth, and I could back the statement with regulations to show this is what the regulations say and this is what we need to do to be compliant. Second thing, advocacy. We are out there every day advocating for providers and their businesses.
Let's talk a little bit about that. Sure. Because tell me, how do you advocate for your members?
So we have a government affairs director, and with that organization, or with the government affairs director position, we also have a lobbyist on hand that we will utilize when needed, depending on, again, the issue at hand. Mm-hmm. We host advocacy days. We do a home care day at the Capitol, which will be coming up in the very near future here on January 24th and 25th. And we meet with legislators at the Capitol. And we talk about the issues that home care providers are dealing with, and not only the providers themselves, but those they serve, and the benefits of home care, and what we need to have in order to be successful in providing top-notch quality care here in the state of Florida. And as you know, Florida is a state where we see more and more people coming here every day, and those 65 and older retiring to the state of Florida. So home care is a big value for the state of Florida when it comes to providing services, healthcare services. We also partner with the National Association for Home Care and Hospice. We attend their advocacy days and the March on Washington, mm-hmm. and we usually will bring a contingency of Florida providers as well, who can, just share their experiences, what they're dealing with on the front lines.
So you guys show up.
Yes, we do. And, the squeaky wheel gets the oil. So if you're not willing to get out there and, talk about the issues at hand, then you're not going to get the support that you need. So we feel it's very important to show up at the state and the federal level.
What is it about working at HCAF for you personally? And I used the expression, what lights you up, in our conversation prior to the podcast a little while ago. And you shared with me that your son lights you up. What lights you up about working with HCAF?
I just love working with people. I guess that's why I'm a physical therapist, and that's why I landed in the home care setting at some point, because it's one-on-one. I can only be with one patient at one time. And I love working with providers, helping them figure out the struggles that they're having. How do we fix the problem at hand that you're dealing with? And I love the success of when it works out in their favor, whether it's a survey issue or citation that they're dealing with, or a billing issue, or just a general compliance issue within their own agency operations. And we help them figure it out. And then they're like, oh, the light bulb goes on, and they're like, this is awesome. I'm so thankful that we have you as this resource. That's what lights me up.
What is it about HCAF's core values that makes it head and shoulders above some of the other associations that might be available to people in terms of what it's able to deliver to its members?
I think the fact that we put members first, it's all, without their questions, without their issues, I wouldn't have a job. So that's what we're here for. And in fact, over 63% of our membership dues goes back into providing services and support for our members. And so for us, it's all about keeping members happy and helping them run their businesses, and allowing them the opportunity to focus on caring for patients. And we can help them with the minutia, with the little details and the things that they're struggling to find, the answers that they're struggling to find, so that we can take care of that piece so that they can focus on taking care of their patients.
Do you find that there's a trend or a type of problem that the home care businesses in the field encounter more frequently than others, that you all are able then to come alongside and serve them with what you do?
I think the biggest issue right now for providers is that, as we've mentioned, there's so many regulations in so many different areas. And so I think for them, especially those that might be newer to the industry, it's almost like drinking through a fire hose. So I think for them, it can be a little bit overwhelming. And so sometimes you don't know that you have a problem until it presents itself, right? A surveyor's knocking at your door and they're asking you these questions, and you're like, oh my gosh, I didn't think about that. Well, how do I fix this? Or what do I do? So I think that for us being there, knowing that, again, they can pick up a phone or send us an email, we'll be there to try to help them figure it out. Mm-hmm. Again, just taking it one piece at a time, because it is so much for them to have to deal with at any given moment, and it can be very overwhelming for them.
Is there a story that you remember of a particular situation where you all were able to come in and, no kidding, help somebody get through a problem that they were having so that it did end up as a success?
I'm thinking a little bit here. Probably the biggest one that stands out to me, it was, I think, a background screening issue, and it was a surveyor, a newer surveyor, and the member, when they were talking with the surveyor, the individual that they hired was allowed to start orientation, but they were not able to go out. When in Florida, you have to have your level 2 background screening done and completed, and you have to have the results first before you can allow that individual to go out into the home and to treat patients or work with patients in the home. So in the meantime, though, the regulation states that you are able to bring them on, allow them to be oriented, just don't let them out in the field just yet. So the surveyor went ahead and was trying to cite the organization because they had begun orientation. They had hired the individual. They began orientation with them, and the surveyor was saying, you can't do that. You can't allow them to do anything with your organization until you get that background screening back. And we came in, the member politely said, you know what, let me check on a few things. I don't necessarily agree with that. She called us. We went through the regulation. We were able to reach out to our contacts at the state level and say, again, can you take a closer look at this? Because, we're looking at a $5,000 citation. And at the end of the day, the surveyor recanted and said, that they were indeed correct with their process and saved them a $5,000 fine.
Gosh, that had to make you feel good.
It did. And in my mind, I'm like, okay, so the little bit that they invested in dues, they recouped, many times over.
Yes.
Yeah, absolutely.
Yes.
Just by making one phone call to us.
Mm-hmm, mm-hmm. What would you say to somebody who was on the fence about joining HCAF?
I would say to them, if you're not sure, come out to an event. We have a process in place where members and non-members alike are welcome to attend our programs. It's just non-members will pay more than a member, sometimes as much as double.
How do we find out about your events? Where can people see what you do and get information about the organization?
They can go to homecarefla.org, and we have a bunch of information there accessible to the general public.
Okay.
And they can go to our calendar of events page, and they can see any event that we host. We do conferences throughout the year. We do webinars, workshops.
All over the state?
All over the state, and on a variety of topics, again, for both private duty and certified providers, as well as homemaker companion and nurse registries. And so if they come to an event and they pay the non-member rate, fantastic. If they like what they see and they want to get more involved, if they join the association within 30 days of attending that event, we'll honor the member rate for that registration, and we'll take the difference that they paid and apply it towards the dues. And if there's any balance left over, then they're just responsible for that payment. And they get to try us out, so to speak, before they get to try the milk before they pay for the cow, right?
So if I wanted to become a member, just in the last couple of minutes that we have here today, walk me through that process.
So they can, again, go to www.homecarefla.org, and we have an online membership application, or they can give us a call, or they can email me. Should I give those numbers? Or,
absolutely.
Okay, so I can be emailed at pheid@homecarefla.org, or they can call us at 850-222-8967, and we'd be happy to help them out, answer any membership questions that they might have, and help them get registered.
It sounds easy enough, and for the amount of time and energy that it would take for someone to check y'all out and decide if you were a good fit for them, the benefits could be very helpful at the end of the day. And I know that for folks in the healthcare industry, it's ultimately about being able to help others. And so for you to facilitate, help people get through that obstacle course that sometimes they encounter. Like you said, you don't know what you don't know till you don't know it, right? I think that you're offering an opportunity for people to consider an operation that would give them the support, the encouragement, and help them make some smart decisions in the future that could cause success and even give them a leg up in some cases that would provide them with an opportunity that they were surprisingly excited to find success at the end of what could be a hard road if they didn't know y'all. So I appreciate you stopping by. And I am Kate Rose. I've been with Patti Heid, who is the Senior Director of Best Practices and Compliance at Home Care Association of Florida. Like and subscribe our podcast, Home Care Today. Thanks for joining us.